Thousands of babies are welcomed to the world every day, but there are risks to everything, even being born. An increasing number of births are being accomplished by cesarean or C-section. In our continuing series on women's health issues, we look at when elective C-sections may be a safer option for women. Once again, here's Lorene Cachola.
Babies. Welcoming new life into the world can be one of the most joyous occurrences for a family. Diet, exercise, and other prenatal care steps are recommended to help women get through pregnancies in ways that protect their health and the health of their babies. Still, complications can make traditional vaginal births more difficult. About a third of the births in the U.S. are now done by cesarean section, the delivery of babies through surgical incision. That's up from 21% in 1998. The latest numbers are from 2006 and show the U.S. has one of the highest rates of any developed nation. Dr. Judith Williams of the Adams-Patterson Gynecology and Obstetrics Group says there are a number of reasons the C-section rate is growing.
Patient choice, patient preference, they feel like C-section is a better choice for them. Secondly, there are older women having babies. That is a huge change in the reproductive age of women. Thirdly, obesity. Obesity rates in the population, at least in the United States, has increased, in my opinion, exponentially over the years.
According to the World Health Organization, a national rate of C-sections that is more than 15% of all births suggests too many are being done. There are times when patients want elective C-sections that aren't medically necessary. It may be to deliver at a certain time or to avoid the discomfort of labor. However, as Dr. Williams points out, there are legitimate reasons why C-sections are often a safer option than traditional vaginal birth. The C-section choice can depend on the size or age of the mother. Obesity makes it tougher to monitor babies during delivery. Older moms are more likely to develop complications during delivery, and the size of the baby is also an issue. Larger babies can actually get stuck in the birth canal.
If you've had a C-section one time, you're automatically increased risk for C-section the second time because of the risks associated with an attempt of labor after having had a previous C-section. Risks of uterine rupture. And if uterine rupture occurs, then you have subsequent risks of damage to mom, baby, permanent brain damage, death to either mother or baby. Some patients, even though the risks are small, they do not want to accept those risks at all. They choose to have an elective C-section rather than putting themselves through those risks.
Because C-sections are surgical procedures, there are medical risks, including blood loss and infections. There are also long-term risks after a first C-section. Those include the potential of a ruptured uterus or excessive bleeding that could lead to a hysterectomy. Generally, vaginal deliveries are safer than C-sections and include some additional health benefits for babies. But if mom or baby faces higher risks with normal delivery, a C-section may be the best choice. For Smart Medicine, I'm Lorene Cachola.